Well, today a lot of people are talking about hormone replacement therapy. It's really a hot topic, and many are concerned about the safety of it, what it can actually do for you, and we're going to have some of those questions answered by Dr. Hale. Dr. Hale, how is what you do different than what someone might have done at the doctor's office?
Sure. A lot of times people ask questions about hormone replacement therapy. It's called HRT. What we do is bioidentical hormone replacement therapy. And what I mean by that, when you say the word bioidentical, what you're really saying is natural.
Okay.
So this is not a synthetic product. Normally when you go to a doctor, he's going to give you a pill like Premarin, Prempro, Premphase, and that's made from a synthetic kind of hormone. Those hormones are made from horse urine, made from pregnant mares. Our bodies are not made to process horse urine. Also, those kind of hormones help just one thing. They're helping the symptoms of hot flashes, and that's about it. May help osteoporosis a tiny bit, but what we do is the bioidentical hormone replacement therapy, which benefits a person in a lot of different areas. So many times, for example, women, men too, but a woman will go to a doctor and say, I'm tired, depressed, I don't have any energy, my sex life, I don't care if I ever have sex again, I'm not resting well at night, I'm under a lot of stress, I don't handle stress well. And so the natural response of the doctor is to say, well, we're going to put you on Paxil, Prozac, Zoloft, Effexor, one of those kind of antidepressants. And the problem is not depression at all. The problem is lack of hormones. So many times when we think about the aging process and we say so many things start happening after I'm 40, 45, and 50. Well, those things don't happen because we're 40 or 45 or 50 or 55. They happen because we don't have the hormones that we used to have. So when you replace the hormones, a lot of the things come back to us the way they were when we were 25 or 30 years old. So in other words, it's a lot of times doctors may say, well, you just have to put up with it. You know, you're older now. Well, you don't have to put up with it. You can feel good again. You can rest good. You can have an active sex life. You can not be depressed. You can handle stress so much better. You can lose weight. We've heard the middle age spread. Well, that happens not because we're middle-aged. It's because we don't have the hormones we used to have. A lot of times men will say, well, I still have a chest, it's just dropped. Well, it doesn't have to drop. And the reason why those things happen is because of lack of hormones. Migraine headaches a lot of times are helped with bioidentical hormone replacement therapy.
It's really exciting to know that there is something that can be done for those things, and that it's safe.
Sure. I love doing this. The reason why is because the doctor's creed is to do no harm. Now, this is so important that you understand this, that the synthetic hormones actually cause harm. Now, they may relieve some symptoms, but there's a higher incidence of breast cancer, for example. When they started doing the study for breast cancer, when you're taking the synthetic hormones, they actually stopped the study early. The reason why is because they saw the incidence going up, and they said, boy, we can't continue with the study any longer because we know what it does. Well, with the bioidentical hormone replacement therapy, they are actually breast protective. So it is probably, it's almost impossible to have breast cancer when you're using the bioidentical hormone replacement therapy. They're actually breast protective. So I feel good about doing things that are safe and help people at the same time. When a lot of times a doctor will say when they're giving you the synthetic hormones, now you can only take these for 6 months or 9 months or a year. We're going to have to get you off of them. The reason why is because he knows that the side effects that they can cause.
Yes. So tell me, when someone begins this type of therapy, what's the process you go through?
Sure.
How often do you come?
Sure. The first thing we do is we take a history. So we find out what symptoms they're having. You can usually pretty well tell from just talking with a person in the first 3 minutes, you know what's wrong with them. You know it's probably going to be their hormones. We draw blood, and we'll get a report back in a week, 10 days. Then we have them come back in, and we say, based on the lab work, based on your symptoms, then we devise a certain regime for that person, based on male versus female, how much they weigh, how tall they are, their symptoms, the blood work. We put all that together, and then we decide what milligrams of the particular hormone that we're going to give. With women, there's two main hormones that we look at. It's the estrogen and the testosterone. And another one is progesterone, but that's taken by a natural tablet. But the estrogen and testosterone in women, men, it's testosterone. Men have a whole lot more testosterone than women do. But understand, women need some testosterone. Symptoms of low testosterone, the main one is tiredness and decreased libido. So women need some testosterone. So what we do is after we get the results of everything back, we put together a plan and we say, you're going to need so much estrogen, so much testosterone. And the medicine is a tiny little pellet, just a little bit bigger than a grain of rice, and they're inserted usually in the buttocks. We numb a little tiny spot about the size of a dime, and we slide the pellets just barely under the skin. We put a steri strip on it and a Band-Aid, and you walk out the door. Especially with women, there is no pain, none at all.
Because they have more fat in that area.
Exactly right, and because it takes less of the testosterone. Now with men, we have to put more in. A man, it's not painful, but it may be a little bit sore for a day or so, like if you cross your legs or you bend over, you may be a little bit sore because we put about 20 times more testosterone in a man than we do a woman. So that's the way it's done. A month later, we draw some blood. A month for women, 6 weeks for men. We draw some blood to see where the hormones went to. And almost every time it's exactly where we want them. Sometimes we may undershoot a little bit and say, man, the tank was, it depends on how low the tank is. So every cell in our body is affected by hormones, every cell in our body, which means that if our hormones are very low, that means we're very dry. And so it may take a while to saturate all the cells. So if we, after 4 to 6 weeks, when we check the blood again, if it didn't get quite high enough, we may have to put in a little bit more. Those usually last 4, 5, or 6 months. Now the reason why the 4, 5, or 6 is that the first time usually it's 4 months. We have someone come back in, they say, I can tell I'm beginning to run out again. And so we just go to the other hip and put more pellets in that one. After the body is completely saturated with the hormones, then usually twice a year they have to come back in.
Okay. What are the ages of most of the people who come to see you?
Well, that's a good question. Most people after 40, 45, 50 in that age, but and anything above that. But sometimes we see people that are even in their 20s, especially in women, in their 20s where their testosterone level is low. We've seen several men, quite a few men, that are in their 30s. When they work out, they don't seem to get the results of the workout like they used to. They don't have the energy they used to. So you can have low testosterone level in men even in their mid-30s. But almost everyone after 40 or 45, and the hormones start dropping off. They don't have to. You can do something about it.
Boy, that's wonderful news.
It is. It is. And we do a lot of different things at HRC. But I love doing this because everyone feels better. It changes. The thing I hear is every day that I work is, this has changed my life. Marriages are, I've got multiple stories. This one couple, they had already separated, going through the divorce. We put the pellets in her. She called up her husband a couple weeks later and says, honey, she never called him honey before, and would you like to come over and talk? And now they're back together. It is, that's a big part of a lot of problems with marriages, and it can help in that area considerably. So I enjoy doing this because it does change people's lives.